Hey class, in this video we are going to continue the discussion on the 8 principles. We are going to talk about the deficiency and excess syndromes. The terms of deficiency and excess we have mentioned in the basic theory. And you should still remember that the deficiency, the difference between the deficiency and excess. Deficiency refers to the deficiency of antipathogenic Qi. The excess always refers to excessive pathogenic Qi. So which means whenever you talk about excess, it's the pathogen's excess. Deficiency is the healthy Qi, the antipathogenic Qi is deficiency. So that's the rules of this term. In order to develop into an excess syndrome, the pathogenic Qi is excessive. But more importantly, the antipathogenic Qi is still not weak. That's why the antipathogenic Qi and the pathogenic Qi can fight and manifest as an excess syndrome. Excess syndrome manifests as an internal build-up pathological product due to exogenous factors, yin and yang, disorders of qi and blood. So what exactly they are? The causes can be all different kinds of pathogenic factors, and the signs can present as excess. It can be sudden onset, can be acute condition, but this definition also not very accurate when you describe the excess syndrome. But you can remember that the excess and deficiency is on opposite sides of each other. So if you don't understand well, or you don't know what exactly an excess syndrome is, you can have a look at the deficient syndrome, and then the opposite side of the deficient syndrome is an excess syndrome. So from the definition, you may know that the excess syndrome, the causes of an excess syndrome can be all different kinds of exogenous pathogens, can be the yin-yang imbalance, or can be the disorder of qi and blood. So actually all kinds of pathogens that we have mentioned in the basic theory can be the causes of an excess syndrome. And then an excess syndrome may, so when I say may, means not have to, may have a sudden onset or in acute condition. Patients often have a strong body constitution, so this means this patient suffers from excessive pathogenic Qi, but a strong body constitution, which means the antipathogenic Qi is still not weak. So the excess syndrome sometimes is very difficult to understand, but when you see the deficiency syndrome, a deficiency syndrome manifested as deficiency of yin-yang blood, body fluid, qi, blood, essence. So which means deficiency is another way to say lack of. The body doesn't have enough yin-yang, body fluid, qi, blood, and essence. So the shut-off is generally characterized by weak, loose degeneration. So whenever you see something can consider as weak or loose or degeneration, it is considered as a deficiency syndrome. So on the contrary, the opposite side of weak, loose, or degeneration is an excess. So very strong, very tense. that's an access. We have introduced all these words, but what does it mean exactly? Or in the clinics, what can we see in this situation? For example, such as cough. Cough is a very common clinical manifestations that most of us should have our own experience. If you don't, at least you should have seen someone is coughing, or your friends or your family was coughing. So from the cough, how do you know it's an excess or deficient? So you can see from the characteristics, a weak. How do you know a weak cough? From the sound, clear, loud sound of the coughing sound as an excess. A low voice, a low coughing sound, and discontinued coughing sounds, that's a weak. What's loose? Such as loose stool or constipation. The loose not only refers to the stool, it also can be the symptoms. Also from the deficiency, the patient may present with fatigue. That's a kind of weak. And excess, the patient may not that obvious have the characteristic, have the feelings of fatigue. The causes of the deficiency. One of the most important causes is the body constitution is not strong. And apart from there, it also can be the cause that's due to long-term cause of the disease. Due to the wrong treatment, which can result in the deficiency of antipathogenic gene. Severe vomiting, severe diarrhea, severe sweating or bleeding. These are all the possible causes of a deficiency syndrome. So for a deficiency syndrome, all what we need to remember is a weak, loose, and degeneration. For excess syndrome, you can see that the patient have a lot of pathological products, such as the phlegm, the water retention, the pus, or the mucus, blood stasis. So these are physical products, pathological products. The patient also may have constipation, that's the opposite to loose. So that's the excess syndrome. So from the table, you can see the comparisons between a deficiency syndrome and an excess syndrome. Duration. An excess syndrome, the course of disease is shorter. A deficiency may be longer, chronic. That's also why we said a chronic condition always will result in a deficiency syndrome. Body constitution. Deficiency syndrome is a weak constitution, excess strong, spirit or energy level low, and excess syndrome, the patient can be still in high energy level, very energetic, voice and breathing, low pitched voice with faint breathing, high pitched voice with rapid breathing. So that's all from this side of deficiency. You can see always the weak, low, preference of pressures. When you press, the patient feel better. Excess syndrome, when you press, they feel worse. So that's the from the constitution, from the voice, from the pen. So from here, you also can see that's how we identify the different from listening, different voices, breathings. aversion to cold. Putting on more clothes is not helpful for excess syndrome. Better after putting on clothes for deficiency syndrome. The reason is for this is if the patient presents with aversion to cold, that's due to the internal coldness, severe internal coldness. That's why when they even put on more clothes, because of the coldness is from the internal of the body. So the patient still feel cold, fever. The patient may manifest it as strong fever. The reason for strong fever or high-grade fever, that's because the antipathogenic qi is very strong. So the struggle between the antipathogenic qi and the pathogenic qi is very violent. That's why it presents as strong fever. The bowel movement, loose stool or constipation. Tongue deficiency, pale, swollen, tender tongue, or rough, thick. Pulse, weak. A weak pulse and forceful pulse is not a kind of pulse, it's a group of different pulse. So you can refer back to the pulse diagnosis. What kinds of pulse considered as a weak? What kinds of pulse considered as a forceful? So these are the common symptoms or signs, different signs between a deficiency and an excess syndrome. The last syndromes, yin and yang syndromes. If you remember and understand well for the 6 previous syndromes, yin and yang syndromes will be very easy for you to understand. The reason is, as you can see from the manifestations, when you see from the manifestations, you will find that there are a lot of symptoms that we mentioned previously. Pale complexion, cold intolerance, cold lumps, clear, you can use mucus here, and saliva, clear perfumed urine, loose stool. So some of you may remember that these are the symptoms that we study in a cold syndrome. The pulse is deep, slow, sweaty. Though some of you may realize that this is the symptoms we study in an interior syndrome. The pulse is weak. That's the deficiency syndrome. So as you can see, although there are many different symptoms and manifestations, you will know that an yin syndrome refers to interior syndrome, deficiency syndrome, and cold syndrome. Similarly, a yang syndrome, you can see different manifestations that can be categorized into an exterior syndrome, excess syndrome, and heat syndrome. So that's yin and yang syndrome. Also from here, you will see that yin and yang syndrome, they don't refer to one syndrome. It is more like a category, yin category, yang category. Patient presents in front of you, you can divide them into 2 categories. This patient is yin or yang, and then from yin or yang, you want to know more specifically from yin syndrome. Is it an interior syndrome? The pathogen is deeper, or deficiency syndrome, or a cold syndrome. On the contrary, if a patient presents with a yang syndrome, is this yang syndrome an exterior syndrome, excess syndrome, or heat syndrome, or the combination of these the combination of these 2 or 3 different syndromes? So that's the 8 principal differentiation methods, the 8 principle. Although we introduced 8, we more focus on 6 because the yin and yang, these two these two are the categories for the 6. So from this study, you will understand the 6 principles, how to identify the principles from these manifestations. These are all the manifestations that we gather from our 4 diagnostic methods: inspection, listening, inquiry, palpation. Also from the descriptions, you will also find out that the yin and yang, the categories that we study in the basic theories at the beginning of our study. When you compare with pale and red, red is the color, the red color is yang. When you compare with low voice and loud voice is yang. So that's how we put them into different groups. Quiet, the yin person is always quiet. The yang person is very talkative. So you may just go through these manifestations, and you also can try to put these different manifestations in the previous 6 principles. Until now, we have introduced all the information in the 8 principles. We have studied one by one, and then we emphasize each of them has different manifestations. That's why we need to identify them. We need to understand, or we need to, whenever we see some manifestations, some symptoms from the patient, we need to group them into 8 principles. So it seems like that the exteriors and interiors, they opposite to each other. That's why we need to identify. But now, here, there's a case. A patient comes to us, present with runny nose for 2 days, aversion to cold, mild fever, cold hands and feet, diarrhea, a red tongue with a thin white coating, a floating pulse. So even now we can see the COVID-19. A patient may present with aversion to cold, mild fever. The patient also may suffer from diarrhea, some cases. Some of them may have a red tongue or thin white coating. This patient also can be the other diseases. But now we have studied the 8 principles. How do you identify the symptom of this patient? So you can, when you watch the video, you can pause for a while and think about what's the symptom, what's the diagnosis of the symptom of this patient. So a patient with a runny nose for 2 days, that's a short course. Aversion to cold, mild fever, this can happen in an active syndrome. Floating pulse also indicates an active syndrome. Thin coating. What's the thin coating? That's also an active syndrome. So firstly, this patient suffer from an active syndrome, but in the meantime, the patient have cold hands and feet, white coating. This can be the cold syndrome. In the meantime, the patient suffers from diarrhea. The diarrhea can be can be accompanied by the cold syndrome, also the diarrhea. When we talk about the exteriors and interiors, the diarrhea is an interior manifestation. So now it becomes complicated. Firstly, I said that this patient is an exterior syndrome, and then I said that this is a cold syndrome, and then at last I said that the diarrhea also a kind of interior syndrome. So what's the diagnosis exactly this patient suffered? The diagnosis for this is the combination of exterior and interior syndrome, and also the cold syndrome. So it's the exterior cold syndrome accompanied by the diarrhea, accompanied by the interior. And for this interior, because the patient only have one diarrhea, it can be the interior, but we don't focus on the interiors. We focus on the exteriors and cold. So you can say an exterior cold syndrome. Again, when we use the yin and yang principles, how do you place this syndrome in yin and yang syndrome? Sometimes it is very difficult. The reason is an exterior syndrome is a yang syndrome. A cold syndrome is a yin syndrome. So an exterior cold syndrome, is it a yang or yin syndrome? That's why sometimes we need to study the combination of these different syndromes. Similarly to the other information, we always study we always started one by one, and then at the end we need to combine them, because most of the time the patient will present with a combination of different syndromes. So that's the combination of different syndromes, combination of exterior and interior. That's the example we have just now. The combination of cold and heat. Is it possible that the patient will present with cold and heat at the same time? It is possible. If, for instance, someone presents with aversion to cold fingers, cold feet, and then the patient have constipation, have dark yellow scanty urine. The patient also may present with mouth ulcer. So that's also the combination of cold and heat. When you see contrary syndromes, you need to identify which one is dominant. When you see a combination of deficiency and excess syndrome, you need to be careful that is it a true situation? Is both deficiency and excess? Is it possible to have a deficiency pattern and an excess pattern at the same time? So that's the question. You can think about, is it possible to have a deficiency syndrome and excess syndrome at the same time? So this is the question that I leave for you to think about. Is it possible to have these contrary syndromes happen together, especially for the deficiency and excess, cold and heat? If a patient presents with these opposite manifestations, what do we need to think about? So in this video, we're going to stop here, and then from the next video, we're going to answer this question. If a patient presents with the contrary manifestations, what should we do? Thank you for your attention.